the answer, and the doc embarrasses him or her, they're in the bathroom crying. Now, what kind of grade is that student going to get? It's not going to happen when you're in PBL, because you were embarrassed the first 2 years with a paper patient, and no one died. No one died. And you learn how to accept constructive criticism. And because you're going to talk about each other, you're going to give constructive criticism to people who come in late. I'm not saying you did. He's probably here at 4 o'clock in the morning. But you learn how to give and accept constructive criticism. You have to realize in medicine, you're going to be a team player. There are no all-stars in medicine anymore. None. Only team players. You could be the best surgeon on the planet. You could work miracles with your hands. But if you don't have somebody putting that patient to sleep, I don't want to be that patient. I don't want to go into an OR that's dirty because the people have not cleaned the OR and sterilized it. You need a circulating nurse. You need a scrub nurse. You need an assistant on the case. And without these people, you're not going to be a success. So you're going to have to learn how to work as a team. That's what PBL does for you. Okay? PBL, I think, is the best way to learn medicine. Because what it does, it teaches the best and the hell with the rest. It really does. It teaches you what you need to know and how to solve problems. Now, everyone, I've asked, okay, if anybody have any questions now, first question that I'll get from every time is, do we get tested on this course? Yes. Hell yeah, it's medical school. You get tested. Boy, the reason that you get tested is simply because you're going to tell us what we're going to test you on. Let's say it's a diabetic case. What did you need to know to diagnose a diabetic patient? Well, you need to know about the histology of the iris. You need to know about the anatomy of the pancreas. You need to know about the physiology of the endocrine system with respect to diabetes. You need to know about the pharmaceuticals for diabetics. You need to know. These are the things that you need to know. So what's going to happen is diabetic case, at the end of this case, after you diagnose this case, you're going to create what are called learning issues. And you're going to give us a list of learning issues. Well, I need to know all these different things. Well, that's what we're going to test you on. You said you need to know these things, we're going to test you on it. So after 3 or 4 or 5 cases, we'll give you a test in all these 3 or 4 cases based upon the learning issues that you give us. Now, we have 26 groups in every class. You know what this means? We have 26 different tests because your learning issues might be different from your learning issues and yours. So we create 26 different tests. A lot of them will be similarities. Well, I mean, if you're diagnosing a diabetic patient, and you're going to come up with a treatment plan with a diagnosed patient, if pharmaceuticals for diabetics is not on your learning issues, then you guys are going the wrong direction. So some of the things will be similar, but some of them might be different. You might want to ask, you might consider gout. You might consider a lot of different things that are in the neighborhood and adjacent, if you will, to diabetics, but not identical to diabetics. So all these questions on the test will be very similar. Some will be different based upon the individual groups. Okay, so this is on Wednesday. Wednesday, you come back on Wednesday morning, and you work your way through the case. And finally, you diagnose the case on Wednesday morning. Now, are you done with the case? No, you still come up with a treatment plan. How are you going to treat the patient? So Friday morning, when you come in, everybody's going to see what's their own treatment plan, how we're going to treat the patient. You might, if it's a diabetic patient, you might recommend metformin, a glipizide, some sort of insulin. And you know what? You can do multiple things. For instance, you can have metformin in the night and the morning, glipizide in the morning. A lot of different things. So you're going to learn a lot of different ways of treating a patient. And that's what the great thing about. Because, you know, you go to a doc, and he or she prescribes one thing. You go to another doc, he or she prescribes something else. You go to a third doc, and you have a lot of possibilities. So you're going to learn about these different possibilities from your fellow classmates. Okay, so that's the problem-based learning course. It's a great course. It really, really is. To tell you how great it is, last year For part one of the medical boards, guess where Bradenton campus was? We had the highest total mean score in the country. Part one of the boards is based upon basic science knowledge. Part two of the board is based upon your clinical knowledge. Guess where Bradenton campus was? Highest total mean score in the country. Part three of the boards is based upon your test that you take in your first year of residency. Guess where Bradenton was? Highest total mean score in the country. So our problem-based learning program works. It works very well. But in addition to the problem-based learning course, what time am I finished? 4 o'clock? 15 minutes, okay, good, 15 minutes, good. In addition to the problem-based learning course, we also have a clinical exam course. That's where you learn how to do histories and physicals on patients. We have standardized patients. We have 9 standardized patients' rooms. And what's going to happen, after you learn certain procedures, certain techniques, then we're going to put you with a standardized patient. And while you're with a standardized patient, we're going to record you. And as soon as you finish your standardized patient event, we will give you the DVD. You get it back. And you spend an hour, 2 or 3 with one of our docs, and he or she will go over your standardized patient event with you, letting you know what you did right, what you did wrong, and how you can improve. So when you come back the next time, you're much better, much smoother as a medical student. Another course that we have is Osteopathic Medicine course. That's where you learn how to use your hands to diagnose and treat patients. For the first 2 years, you will have every semester a course, problem-based learning, clinical exam, and osteopathic medicine. First 10 weeks, you'll have an anatomy course, a very, very basic anatomy course, 10 weeks. Now, you might want to ask, how come only 10 weeks of anatomy? When the average medical school has 25 to 35 weeks of anatomy. How come we only have 10 weeks of anatomy? Well, simply because you're going to have anatomy in every PBL case. You're going to have anatomy in your clinical exam course. You're going to have anatomy in osteopathic medicine course. And as a result of the anatomy and the other 3 courses, we have the highest anatomy grades in the country on the boards. The highest. Our program works. So you can do this for the first and second year. In addition to that, you're going to have 12 courses that we have, and they're all small courses. And they're only maybe 8, 10, 12 hours long. You have a course in public health, in medical jurisprudence, in healthcare management, human sexuality, a lot of different courses. And what this is to turn you into a well-rounded physician. That's the first and second year. At the end of the second year, you take part 1 boards, and here's where you shine on boards. Third year, you do your rotations. Third, fourth year, you do your rotations. And with the rotations, that means you're not on campus. You're in a hospital, you're in a clinic, you're in a doctor's office. And you're going to do that for 48 out of the 52 weeks. Each of these years, 48 weeks of learning divided by 4 weeks each rotation, so you have 12 blocks. 12 blocks. Each block is 4 weeks long. We'll have three blocks in internal medicine. You'll have 1 in family practice. You'll have 1 in OB, 1 psych, 1 peds, and you'll have 2 in surgery. You're also going to have 3 rotations of electives and selectives. Elective and selective, you pick wherever you want to go, anywhere throughout the United States. You can't go international because when I was out in California, we had a student that wanted to go to Iraq, and we're not about to send a SWAT team in. So we kept them only in the United States, simply because it's just a dangerous world out there, and it's getting more dangerous. If you want to go out there on your vacation, you go wherever you want. You just don't put my name with your travels. Okay, so third year, fourth year, it's the exact same thing. 12 4-week blocks. The only difference is now you only have 3 weeks or 3 rotations required. 2 emergency medicine, 1 rural ambulatory. The other 9 are elective or selective. You pick and choose where you want to go. If you wanted to do anesthesia, you've got to do your rotations, your elective rotations in 3rd or 4th year or anesthesia. simply because you want to audition for residency programs. If you do not audition for residency programs, I have a better chance of getting pregnant than you getting in. It's not going to happen. Now, last year, there was 9,000 people who graduated from medical school who could not get into a residency program because there's not that many. So when you choose a medical school, choose a good one. The difference between a good one and a bad one is you not getting into a residency. You know, when you graduate from medical school after 4 years, you're called doctor. But until you do that first year internship or residency, you cannot practice medicine. You cannot practice medicine at all. Last year, I had 17 calls from people who graduated from the Caribbean schools. And one who graduated from Guadalajara, Mexico, one from another medical school, and one from over in Poland. They cannot get into residency programs. They wanted to start over at our school, simply because how successful our school is. One student was over $600,000 in debt and cannot get into a residency. No way in the world I can start my medical school. Could never pay off the loans. Never. And I felt sorry for him. Sorry for him. So pick a good medical school. Difference between a good one and a bad one, like I said, you're not getting a residency. We have never had a problem getting students into a residency. Never. Never. Last year, a #1 student in class got accepted to Cleveland Clinic for vascular surgery, one of the top 3 vascular surgery programs in the United States. #2 student went to Johns Hopkins for pediatrics. Went to great, great programs. It's up to you. Okay, that's a little bit about our school. Anybody have any idea what kind of docs you want to be? Yes? Orthopedics. Yes. Good, good, good.
Family medicine.
Family medicine. Great. Good. You can be all those as a DO. Because you know what? When you graduate from an MD school or a DO school, you're going into the same residency program. It makes no difference. My daughter, when she was about that tall, she wanted to be an OB-GYN doc. Had no idea what the hell OB-GYN was. The only thing she knew, she wanted to take care of babies and take care of mommies and deliver babies. That's the only thing she knew, ever since she was little. So in junior high, that's what she wanted to do. In high school, in college, medical school, up to the last rotation of her 4th year. She wanted to be OB-GYN doc. She fell in love with one of her classmates. And he wanted to do family medicine. So she gave up her OB-GYN residency to do family medicine residency in place. She changed at the last minute. My son, I told you about the son from UCF. When he was about 11 or 12 years old, he came to me and said, you know, Dad, I'm not sure I want to be going to medicine. Great, because you don't have to. But he kept saying, no, I don't want to. No, I want to. With the same breath, what do you think? I think I should be. And so anyway, what happened, he kept saying, well, if I go into medicine, I know I'm not going to have a life. And I said, well, what do you mean by that? He said, well, I know I'll be studying real hard. I'm not going to have a life through junior high, through high school, through college, medical school, internship, residency. I'm not going to have a life at all because I'm going to be working so hard. So you know what I want to do, Dad? I said, what do you want to do, Chris? He said, I want an easy job when I finish residency. Easy job? What the hell could that be? He said, I want no stress in my life. I want to kick back and relax. I want to enjoy life. I want to take care of patients 3 days a week and golf the other 4. I want to be a dermatologist, Dad. He's an ER doc today. He changed. He changed. His second rotation, the elective rotation in dermatology, he calls me on the phone and says, Dad, I can't do this. I said, why? He said, all I'm doing is shaving skin all day. It's so damn boring. So he went to Arrowhead Regional in Southern California. He did his residency in emergency medicine. And when he finished his residency, he went to UCLA, did a fellowship in ultrasound. There were 61 people that applied for this fellowship in ultrasound. 61. 58 MDs and 3 DOs, and he got it. And honest to God, it didn't help him. I did not help. He got it on his own. Simply because he wanted to do it. He fell in love with a girl, another DO, and she went to emergency medicine in UCLA for her residency program. So we have 4 DOs in our family, and quite honestly, I'm pissed off at all of them. You know why? None of them are into geriatrics or psychiatry to take care of me. All I'm trying to say is you can do whatever you want. Just make sure that you work on it. I'm a firm believer in the WIT theory, W-I-T, whatever it takes. You guys are much smarter than me. And if I can graduate from college, get my doctorate in 5 years, you guys can do very similar things. Work hard. If you might give up a little bit today, but tomorrow will pay off big time. Last year, first of all, I had no intentions of ever leaving LECOM. Last year, I had 13 job offers. I wasn't looking for a job. Penn and the education that I got did it for me. You guys have the same opportunity at this school through this education. Please don't waste your time. Really, put forth an effort. Give up drinking beer this week and maybe read a little more. Okay, any final questions? Anybody have any questions? Yes?
Did your daughter ever regret it, or like did she ever think back on her decision on changing?
Did my daughter ever regret giving up her OB-GYN to a family practice residency? Right? That's the question. Well, it was funny you asked that question because she thought what she would do as a family practice doc, she would do some OB. No surgery, just OB. And possibly some L&D, labor and delivery. Until she found out that the malpractice insurance was so high that she'd have to deliver 2.5 babies a week just to pay for malpractice insurance. So she decided no. So no, she didn't have regret it. Any other questions? Yes, sir.
I saw on your website that you have an accelerated PA program and then like a internal medicine scholars program. Can you expand just a little bit on those?
We have our Master of Medical Science program. Mm-hmm. We don't have a PA program.
Okay. Well, I was just wondering, like the PA to DO. I was.
Okay. I'm sorry. Let me explain. We have 3 programs. We actually have 5 different pathways. If you're coming to Bradenton, you're only going to do PBL because that's what we have. If you go to Erie, there's 3 other pathways that you can participate in. One is a lecture discussion. That's where you sit in class in the lecture hall for 4 or 5 hours a day, 5 days a week. And then more lecture than discussion is called L&D, I don't know why. And the 3rd pathway is independent study. Okay? Independent study is a program where you learn one-on-one or one-on-two with the doc, 1 or 2 docs. The other 2 programs that we have, if you're interested in primary care medicine, that's probably what you're talking about. It's a 3-year program. You graduate from medical school in 3 years rather than 4. You save 1 year of tuition, 1 year get into a residency, 1 year early. But you only can do family medicine or internal medicine. So let's say that you are in this 3-year primary care scholars program, and halfway through this you do an elective rotation in surgery. Man, I love surgery. Sorry you can't go into it because you're in the 3-year primary care scholars program. So you must be damn sure that that's what you want to do. The 5th program that we have, if you are a PA, a physician's assistant, you go to the PA program, you graduate in 3 years rather than 4. You do your first 2 years of basic sciences and only 1 year of clinical rotations because as a PA, you've already had some clinical exposure for a year. That's probably what you're talking about. So it's a great program, really great program. Anything else? Okay, thank you very much. Thank you.